Hi friends, and welcome once again to the channel. This is TWTV and this is your wellness way. My name is Dr. Raymond Bodi. Please subscribe, share, like and comment. Let's get interactive, okay? Today we will talk about the abuse of emergency contraceptive pills. Yeah, it is worth to talk about this. Now, it's been very common these days that right after sex or unsafe sex, you resort to these pills in order to prevent pregnancy. Okay, so you might be a lady and you are ovulating, okay, and then you have unsafe sex, okay, and the result is that you're going to get pregnant, but then you are not ready for that, so you need to resort to these pills that will prevent you from getting pregnant. All right, and so that is what you use the emergency pills for. Now, there are also other women too who are already on a birth control methods and they have failed, and so they also had to resort to these pills. All right, so these are the two people that actually mostly use or abuse these drugs. Now, they come in one or two pills or tablets depending on the dosage and the brand. Okay, now how does it work? How does this drug work? All right, so as I said, doing ovulation is possible that you get pregnant when you have unsafe sex, and so the pills have these female hormones, all right, that would inhibit ovulation, and then it will also take in the cervical mucus and thereby preventing sperm cells from moving into the uterine cavity. All right, so that's how the drug works. You see, that's the mechanism of action of the drug. Now, it's common, it's sold without prescription, drugstore, pharmacy shops, OTC, over-the-counter drugs. Provided you are 17 years old, okay, and above, you can be given this drug, all right. However, it comes with so many severe and fatal effects, okay. Now, before we talk about the harmful effect of this drug, know that when using this drug, okay, there are certain drugs too that could interfere or interact with these drugs. So if you are already on a sleeping pill, if you are having high blood pressure and then you have been given medications to reduce the high blood pressure, if you are on a TB drug, if you are on a pain reliever, if you are on a fever reliever, okay, they are going to interact with the drug and therefore could reduce or decrease its efficacy or its effectiveness, if you will. All right, and so if you're taking this drug, you know that you should not be taking additional drugs as well at the same time. Now, let's get straight to the point. So what are the side effects? Now, we have the common side effects and the, let's say, long-term side effects. So with the common side effects, just like any other drugs, okay, do have their side effects. Okay, with these ones, one, you might experience bleeding, you might experience irregular menses or menstruation disorders, you may have headache, you might have breast pain, dizziness, nausea, and so on and so forth. Okay, what about the long-term abuse? Complications that might arise. Now, it might have a long or a very serious effect on your fertility. Yes. Two, you might stand a higher risk of developing breast cancer. You will have what you call the uterine lining atrophy. You might experience or have a risk of renal, that's kidney, liver, that is, and then cardiovascular complications as well. Now, these drugs, these pills, okay, are considered as a double-edged sword. in as much as it's preventing you from getting pregnant, it has a lot of, or so many harmful complications that would actually affect you, not now, in the future. Please do not abuse this drug. Thank you for watching, and see you again soon. Bye for now.